Randall Braddom. My friends all call me Randy. I was president of the AAEM beginning in the fall of 1990 and going on until the fall of 1991. The annual meeting that I was president was the one in Vancouver. I've been asked to respond to a couple of questions here. One of them was, what issues were you facing when you were president, both within the association and in the external environment? The issues that we were facing at that time included such things as the first use of RVUs for payment for electrodiagnostic services. At that time, we had decided to use relative value scales. The government had decided to use relative value scales for Medicare payment. And of course, we were all concerned about what that would mean for electromyographic reimbursement. And so the big item, I think, that affected everyone's pocketbook at least, was how the RVUs were going to fall out. Another issue that we were coping with, and still coping with actually in the organization, is the American Board of Psychiatry and Neurology had developed a residency program for various kinds of electrodiagnostic medicine, including EMG and EEG and sleep studies and so on. And those individuals taking that had to pass an examination at the end to get added qualifications. And the question was whether those individuals should be able to become regular members of the AAEM, or if they should have to take the ABEM examination. And so we struggled with that. At that particular time, it was our feeling that while these individuals were obviously learned individuals, and while they had excellent training and were experts in many ways, they had not had adequate EMG training per se to meet the criteria. And their examination per se was not one that was equivalent to the examination given by the ABEM. Another issue we had was on quality assurance. That was back when QA was very important in American medicine. And quality assurance studies were all the rage. And so we had a long discussion about how we could fund a study on nerve conduction studies of the median nerve from a QA standpoint. Also, we were just beginning to realize that in the future, we were only going to get paid for doing things that you could prove to be efficacious. And consequently, we started thinking about how we could prove that electromyographic studies and electrodiagnostic studies were efficacious. And consequently, we started an ad hoc research committee, which went out and looked at the concept of doing fundraising as a foundation to establish an endowment, which we now have, of course, but which back then we were just beginning to discuss. Those were some of the main issues. I hasten to point out that in any presidency, it's hard to claim that you did any particular thing, because most things in the AAEM, like most organizations, take a number of years to do. Any given idea that comes forward usually takes 3 or 4 years before you can get it to the board, get it funded, get it implemented. And so there are usually at least 3 or 4 presidents who have the right to claim that they're the ones who did that, because it's very difficult to do anything in a single year of your presidency. Another question I was asked is, what is your fondest memory as president? And my fondest memory, I think, was at the presidential talk. The presidential talk at that time was done just before the president's reception. It was not done as part of the business meeting. And there was quite a crowd for it there in Vancouver, and I spoke on the first 5 years, the history of the AAEM, and I really enjoyed learning about that history, and I enjoyed giving that talk. And I think it was one of the talks that I enjoyed most ever giving, and one of my fondest memories. But I have many, many fond memories, the many committees that I served on, and the people I met, getting to know a lot of physiatrists, and especially a lot of neurologists whom I otherwise probably would never have met. And the dinners we would have, and the jokes we would tell, and it was really a lot of fun. I'm a tennis player, and so at every meeting, we always managed to have a tennis match or two, and over the years, I've gotten to know a lot of people through playing tennis, including individuals like Bob Miller and Les Dorfman. The final question was, what would it like to practice medicine, or specifically electrodiagnostic medicine, when you were president? When I was president, we were still in what I consider to be the sort of heyday of electromyography. But when I was a resident, I sort of had the feeling that electromyography in particular was a late 20th century phenomenon. I learned how to do it from one of the masters, Ernie Johnson, and I did thousands of them and still do electromyography. But it was my feeling back in the 1970s when I was in training that undoubtedly over the course of time that there would be new studies that would be developed, many of which would ultimately come to replace the EMG. I did not frankly think that in the year 2001 that I would still be doing EMGs. I thought, as I mentioned, it was a late 20th century test that would ultimately be supplanted. And so I've been surprised actually at how the EMG is still popular. But back in 1991, of course, at that point I can say that it was somewhat more fun to be an electromyographer because you had more freedom to do EMGs on patients. And we had less competitions from other kinds of studies. Genetic revolution hadn't really fully occurred yet, and so in genetic diseases, we're still using EMG more than genetic tests. We had the CAT scanner, but the MRI really wasn't as good as it is now. That wasn't competing with us. And so it was probably in many ways more fun to be an electromyographer at that point. Our equipment, frankly, wasn't that good. We did have digital equipment for the first time. So our EMG equipment was almost as good as it is now. Not as portable, but almost as good as it is now. And so I think it was more fun to be an electromyographer at that time. We didn't have as much competition at that time. But again, I want to reiterate that I'm surprised by the fact that I'm still doing EMGs, because when I first learned to do them in the 1970s, I really had no idea that we would continue to be doing them in the year 2001. And it looks like from where I sit, that we'll be doing them